Institute in Seattle, Washington, and I see patients at numerous locations throughout the greater Seattle area, including Issaquah and Pierce County. I work for a clinic called Northwest Natural Health, and we specialize in working with patients with cancer. We have been doing this for over 3 decades. So let me go on to that next slide. Sorry about that. Hold on one second. There we go. So we've been doing this for over 3 decades. We have seen thousands of patients and get them successfully through treatment, mitigating side effects and using evidence-based therapies, some of which I'll be discussing today. So what can you expect from this webinar? Well, a better understanding of the role of naturopathic doctors in your cancer care journey. And this is especially important for those listening outside of the state of Washington who may not be familiar with what a naturopathic provider is and how they may fit into their healthcare system. And this varies from state to state. In addition, an understanding of why side effects occur in order to better understand how to possibly prevent them from happening. And here we'll go into a bit of some pharmacology and physiology and maybe some other ologies, but hopefully none of this scares you away quite yet. Hold on. All right, and then how to safely manage side effects. So there'll be some take-home strategies, some do's and don'ts or things to avoid. And of course, the caveat being that whatever I may be recommending may not be best for all, and therefore should always be discussed with a knowledgeable naturopathic doctor or provider. I also encourage all of you, if you are experiencing any side effects from treatment, it is so important to discuss this with your provider. All right, so naturopathic doctors. So what we offer is supportive care in oncology. We sometimes use this term adjunctive naturopathic management, meaning that we provide safe, effective, evidence-based treatments to help manage symptoms and side effects in order to improve your quality of life and, more importantly, treatment outcomes. And there are some other terms that are fairly synonymous for me, such as complementary and alternative or CAM. But what's unique about Northwest Natural Health Services is that not all naturopathic doctors are in a hospital system or have undergone extensive training in naturopathic approaches for patients going through oncologic treatment. In addition, if you're a Swedish patient, we have access to all of your medical records, including your labs and provider's notes, and are able to quickly and easily see how you are progressing and coordinate with your team. We understand that you have a lot on your plate and you're juggling appointments and spending a lot of time at doctor's offices, and we want to minimize your stress as much as we can by making the best choices for your care and maximizing your time spent in the office. If you're going to find a naturopathic doctor in another state outside of Washington, try to look for someone who is integrated in your hospital system and able to coordinate with your care team. So I do 3 major things with all of my patients. Number 1, keep you as strong, healthy, and comfortable as possible before, during, and after treatment. 2, avoid any unwanted interactions with treatment. And 3, add in any prevention strategies. So number 1, so keeping you, the patient, as strong and healthy and comfortable as possible before, during, and after treatment. Well, what does this look like? Well, in order for us to do this, we conduct a comprehensive review of systems. And what this means is we ask you a number of questions and get this whole picture of who you are as an individual, connect the dots, and then come up with a plan that keeps all aspects of your health in mind. In addition, we'll review your records, address any pre-existing conditions. Certain pre-existing conditions may affect how well one tolerates treatment. We also address any treatment side effects that may potentially interfere with your ability to tolerate and complete treatment. This is really where integrative care shines in improving treatment outcomes and quality of life. Next one. So we spend quite a bit of time and attention in avoiding any unwanted interactions with treatment. So not all naturopathic doctors specialize or are knowledgeable about oncology and drug, nutrient, herb interactions. The providers at Northwest Natural Health have extensive training and expertise in this area. So what does this kind of look like? When side effects are taking place, friends and families or even other providers with the best intentions may recommend treatments that can reduce the effectiveness and increase adverse events of chemotherapies or targeted therapies, radiotherapies, and even surgery. Not to mention, the recommendations can be expensive. So naturopathic doctors at Northwest Natural Health know what to use and when to use it to mitigate side effects and make sure we're not interfering with your treatment. Always discuss any supplements, herbs, or other medications that you may be taking with your provider. If the provider isn't familiar with the supplement or herb, they are always welcome to call our clinic, and that number will be provided at the end of this presentation. Or you can refer to the list of other online resources. And then we add in prevention strategies. We provide safe, evidence-based strategies that all patients really want to know about to prevent disease recurrence. Some recommendations around side effects are also ways to prevent illnesses down the road. And this is again done through this whole person approach. So my goal, as I see it, is to really encourage my patients to implement good health habits towards disease prevention. Alrighty, so we don't want you suffering with side effects. And after a diagnosis like cancer, side effects can become a major concern, especially when we start talking about chemotherapy as a therapeutic option. Disease and treatment, side effects could be the reason why one went to the doctors in the first place, or the reason why someone may be reluctant to move forward with treatment. They can occur at any time before, after, and or during treatment, or simply not at all. It can be a reason why patients decline treatment or why providers may stop or discontinue treatment. In the case of blood cancers, where treatment can go on sometimes for many months to years, the drugs and their toxicities accumulate in the system, and the side effect profiles are potentially more likely to occur. So as you can see, there are many reasons to discuss and address side effects, and there are numerous options available, as I will only be discussing a few commonly used therapies, things you may have tried, heard of, or didn't know anything about. And like I said, trained naturopathic doctors are able to intervene at any point during your care and cancer journey. You don't need to go through this alone. So we're not going to be able to talk about each individual chemotherapy agent or treatment and their side effects, but we'll talk about a few commonly seen ones and why they occur. So briefly, chemotherapies, they have gotten fairly sophisticated and better tolerated with the advent of biologics and immunologics. But chemotherapy is a drug or combination used to kill cancer cells by disrupting and interfering with processes of cellular division. Cellular division is how cells grow and spread, and cancer cells, they're very metabolically active. They're rapidly dividing cells. They want to grow, and then chemotherapy comes in and stops this from happening at all different parts of cellular division. So chemotherapy targets these fast-growing cells that are rapidly dividing, but also some normal cells. And some of these normal cells, they're in our digestive system and nervous system, musculoskeletal system, etc. And as these cells are being targeted, this is when we start to see some side effects. So the big 3 or 4 major side effects that I see kind of on a daily basis with my patients, they're constipation and diarrhea, fatigue, and neuropathy. So why does constipation and diarrhea occur? Well, the digestive tract is this long organ. It spans from your mouth all the way to your anus. It connects the outside world with the inside world. And It contains metabolically active cells. So these are cells that turn over quickly. And as mentioned before, chemotherapy targets these cells and destroys them. So as this inflammatory process occurs, one may start to experience diarrhea, and the opposite of which, constipation. So what makes diarrhea better? Imodium or loperamide, this is a commonly used antidiarrheal. It acts by slowing intestinal motility and by affecting water and electrolyte movement throughout the bowels. Loperamide binds to the opiate receptors in the gut wall, and this can lead to the opposite reaction of constipation. Imodium is an option, and it's absolutely effective, especially when physicians want to act quickly to avoid dehydration and maintain electrolyte balance. Some things can be done in addition to or instead of using Imodium. So it's so important to stay hydrated, and this can be done with broths, congees, water, electrolyte drinks, also binding agents. And there's a food-grade bentonite clay, which is a binding agent. It's something that's going to slow down transit time and adds bulk to your stools, but doesn't constipate. And then there are a couple herbs and some foods that these herbs and foods, they coat and soothe the digestive tract, and they can be brought on board in order to reduce inflammation. Always use care and caution to choose herbs that don't interfere with treatment and that are quality sourced. So some of the ones that I gave examples of here, one is DGL, which is an extract of licorice. It's not the candy, it's a root. Slippery elm, Ulmus fulva, and Plantago major. And plantain, that's a common weed we see in the Pacific Northwest in Alaska, and it's great. It's nature's Band-Aid. And these can also be helpful with chemotherapy-induced nausea. So here are some of the options to help relieve diarrhea, and then we'll discuss constipation, which also has some treatments that may be helpful for diarrhea. So why does constipation occur? Well, it can be an opposite reaction to diarrhea. It can be induced by steroids or opioids, diet, and hydration. So why do opioids cause constipation? Well, opioids work to kind of slow down the nervous system. They block certain receptors in the gut and reduce activities such as peristalsis, which is the action of your gut doing its job to break down and move foods throughout the intestine. When peristalsis is reduced, this can lead to nutrient absorption issues. And I'll explain in a bit how this can contribute to ongoing or worsening fatigue. With constipation, there are a few strategies and some things to avoid. I generally recommend away from long-term use of laxatives such as Senna or Senokot, which is a cathartic laxative, and it can interfere with some treatments. As well as avoiding enemas and colonics, there's a time and a place for these therapeutic options, but generally not during cancer treatment. There are some things that I do to kind of encourage and help resolve constipation, and a lot can be done with certain foods. So I recommend my patients address the constipation initially through dietary changes, including eating more of certain fruits and vegetables such as pears, peaches, nectarines, apricots, and squashes. They contain both soluble and insoluble fibers, and this helps to add bulk and moisture back into the stools. And then magnesium. I literally could talk about magnesium for an hour. So magnesium is this incredible mineral. It's involved in more than 300 essential metabolic reactions. It's a constituent of bones and teeth. It helps to relax nerves and nerve impulses and kind of calms one down. It's a gentle osmotic laxative, and magnesium can be diminished if one is experiencing a lot of diarrhea over time. Magnesium is found in nuts and seeds and fruits and vegetables. In addition, it is so important to spend time chewing one's food. Chewing adds in natural digestive enzymes that aid in the breakdown of food and helps the digestive system so it just doesn't have to work as hard. So we in this culture are often not slowing down or spending time really chewing and focusing on our food. Digestion starts in the mouth. The simple act of chewing allows the production of bile and other digestive enzymes that act as potent physiologic laxatives. The simple act of chewing, sitting in a quiet, peaceful environment, so not eating in a rush, provides the body time to secrete digestive enzymes, which can also be impaired with certain medications. Digestive enzymes are not probiotics. Digestive enzymes are the body's lubricating and moisturizing agents for the stool. So a lot of what I'm kind of talking about here are strategies to address both constipation and diarrhea, are ways to support the gut microbiome. Naturopathic doctors are excellent and extremely knowledgeable with addressing and treating gut health and the gut microbiome, which is this whole new hot field of research. And as research is discovering, gut health and the gut microbiome are major indicators of overall health and well-being. So fatigue. From what I have witnessed, fatigue is probably one of the most common and debilitating symptoms experienced by patients with cancer. It is characterized by these feelings of tiredness, weakness, and lack of energy, and it's distinct from the normal drowsiness experienced by healthy individuals in that it's not relieved by sleep. It can occur both as a consequence of the cancer itself and as a side effect of the treatment, but the precise underlying pathophysiology is largely unknown. We do know some reasons for fatigue, and honestly, there's a lot to be said here. There's a huge mind-body connection as well, and we'll get into that a bit here. But if fatigue can be due to anemias, it can be due to malabsorption or malnutrition, so you're not absorbing enough nutrients from your food or simply not getting enough protein or other nutrients. It can be due to stress from the disease itself, from environmental stressors. Stress can inhibit one's ability to digest or absorb food. Feelings of fear, concerns around health, grief, loss, depression, anxiety, chemo brain, lack of sleep or poor sleep quality, or just general inflammation. There's a lot of reasons for fatigue, and some of which should be understood by your provider in order to address the fatigue appropriately. So we'll start by talking about meeting nutritional needs to help with fatigue. So I think you kind of get it by now, or hopefully heard me say this enough, but making sure you're digesting and absorbing your foods and getting enough protein and then being able to break it down into all of the amino acid parts. So amino acids, they are the building blocks for energy production, and they can help reduce fatigue. Eating good quality foods that are also nutrient dense. So this could be a whole foods diet or an anti-inflammatory diet, which is the diet that I propose and kind of teach to my patients. There are also ways to eat a healthy diet that simply doesn't break the bank, such as by focusing your diet on whole grains, healthy fats, proteins, and lots of fruits and vegetables. Following a diet that reduces inflammation can be extremely beneficial in improving fatigue and survival. And then there's a time and a place for vitamins, nutrients, and possibly infusions, especially when appetite is diminished or nutrient absorption may be hindered and one is experiencing fatigue. Fatigue can be improved when nutrient demands are met and the body is absorbing all of the vitamins and minerals it needs to function. A high-quality supplement to replenish the body with nutrients that one may not be getting from their diet is something worth considering. I also often see that my patients are on too many supplements that they don't often need, which can be both expensive and in some cases harmful. I tailor this list with all of my patients and discuss with them some of their options. So as we've discussed here, meeting nutritional needs that can improve symptoms of fatigue. So we'll talk a little bit more about this. So spending some time getting in exercise, just as simple as a brisk walk, as much as 20 minutes per day, can be so beneficial for combating fatigue. And I know, it may seem totally counterintuitive to exercise when one is fatigued, but exercise is so powerful, again, for that mind-body connection. What I see for my patients, especially the ones that are able to exercise regularly, it improves their energy, their mood, and even sometimes their treatment outcomes. I have a couple patients right now with multiple myeloma. These ones come to mind first, who are able to exercise on a regular basis, and they have been reporting overall improvements in quality of life measures, less fatigue, more energy, better stamina throughout the day, better mood, and this has also kind of been coinciding with improvements in their disease markers. Spending some time exercising every day, it really doesn't have to be strenuous. Just this gentle elevation in heart rate is so beneficial towards combating fatigue. An extra bonus for those in Washington and Alaska who are able to get outside and spend time in nature and able to do these activities with others. So, spending time with loved ones and doing activities that you enjoy that takes your mind off of your health can also be so beneficial towards reducing fatigue. It is normal to be concerned about health, but it is just as important to continue to engage in activities you enjoy with those you enjoy doing them with. As much as you can, just leave the health concerns to your doctor's visit. So we have just discussed some things one can do to combat fatigue and improve energy and stamina throughout the day. 1 was meeting nutritional needs. 2 was exercising for 20 minutes every day. And 3 was engaging in daily activities. So we'll now talk about the last, and probably for me, one of the most common side effects that I see, a reason for a number of the referrals that I get here, neuropathy. So some of you may be wondering, why in the world does neuropathy occur? You can imagine your nerves, they're like a wire, and nerves are wrapped in this protective outer coating, kind of like a wire, that gets damaged and inflamed by certain medications and chemotherapy agents. And when that outside layer gets worn out, one may start to experience pain, numbness, or tingling sensations in the arms, legs, hands, and feet, which is known as neuropathy. The conventional option for neuropathy is gabapentin, and this alters the way the body senses pain. With gabapentin, sometimes the signals disappear and sometimes they are just quiet. This can be helpful for some, but also can make others drowsy. Unfortunately, it doesn't quite fix the problem or repair the nerves. My director, Dr. Dan Labriola at our clinic, Northwest Natural Health, were the lead investigators for a trial with Velcade, L-glutamine, and P5P, which is the active form of B6. And it's important that it's actually that active form for neuropathy. So these nutrients were administered at high doses way above the RDA and on board before symptoms started progressing. Some other nutrients are also starting to be used as well and done intravenously. These are glutathione and alpha-lipoic acid. So although neuropathy can be troublesome, there are options, both conventional and naturopathic, available. So just to recap and review, naturopathic doctors offer adjunctive supportive care for cancer patients. We're knowledgeable in safe, evidence-based therapies to improve quality of life and treatment outcomes. And I aim to do 3 things with my patients. 1, keep you as strong, healthy, and comfortable as possible before, during, and after treatment. 2, avoid unwanted interactions. And 3, add evidence-based preventive strategies. Hopefully you now understand a bit more why side effects occur and how to possibly prevent them from happening. Or if they do occur, what you can bring on board or discuss with your providers. And lastly, maybe a couple of take-home strategies, some dietary recommendations such as following a nutrient-dense diet, the importance of digesting, absorbing, and breaking down your foods, some lifestyle ideas like exercising, spending time in nature, and doing activities you love with the people you enjoy doing them with, and a couple of nutrients, magnesium, P5P, and L-glutamine. Be gentle and patient with yourself. Keep in mind, change takes time and you do not have to suffer with side effects during treatment. Speak with your doctor or providers when things come up, and feel free to call my office with any questions or to request an appointment. We covered a lot in a fairly short amount of time, so there are some additional resources at the end, and let us know if you have any questions. Thank you so much for listening, and Erin at the Leukemia and Lymphoma Society for asking me to speak and arranging this, as well as Carissa here at Swedish Cancer Institute, who has been so incredibly helpful. Once again, I'm Dr. Morgan Schuster, and this was Blood Facts, Naturopathic Medicine and Side Effect Management in Blood Cancers.